Sarah. My main clinic is in Klang. Anyhow, I've been a GP for more than 20 years, 25 years. I actually first came across the products from AFC. I was introduced to it by Mr. Kenny, my upline. At that time, it was in March last year, March 2024. I had, from my personal experience, I had a bout of chikungunya. I was infected with chikungunya, and I had very severe joint pain, and I was taking a lot of painkillers to relieve my pain. And the pain from January until March was still persistent. So Mr. Kenny introduced to me the product, and when I saw the products, the patents that came along with the products, for example, like Subarashi had 4 patents, Usukushi had around 8 patents. I was amazed, and so I decided to give it a try. And within 2 weeks, my joint pain, my morning stiffness all disappeared. That's why that's my personal experience using it. At the same time, because I was going to perform my Hajj in June the same year, so I was a bit worried. So I maintained using it to preserve my health. I also had a personal problem whereby I had palpitations when you feel that your heart is pumping very hard for the past 1 year. So when I started using Subarashi and Usukushi, I didn't really feel any difference. It was only after 2 months or 3 months consuming the products that I noticed that my palpitation had disappeared. So then again, that made me believe more in the products. Basically, some people are a bit confused with because there's 3 products. So I tell my patients, just my friends who will start consuming it, Subarashi is for repairing, just to remember that. Usukushi is for immune enhancement and detoxification. And anything with regards to the brain and eye, we use Ikari. But we can combine both. We can combine all 3 whenever there's a need to do so. So basically, I also have been using it for my own family members. I have 2 grandkids. So one of my grandson, earlier this year, was diagnosed with pneumonia, and I passed a few sachets of Usukushi for my grandson. He's 2 years old, and within 1 day, he was put off oxygen. Meaning, previously he was on oxygen, then the following day he was no longer on oxygen. He improved very fast. He also had similar attack, I think last month. I think probably due to the weather and due to weather, I think. So I repeated the same thing. I supplied a few sachets. Within 1 day, 2 days, off oxygen. So I see the product's efficacy in my family members. I have also been using it for my patients. In particular, one of my patients who had a very bad skin infected abscess post-operation, whereby the lesion, the wound didn't look healthy. So my patient had diabetes, and the sugar control wasn't very good. So after I asked her, I persuaded her